Hello, and welcome to the Safe at School Back to School webinar presented by Your American Diabetes Association. I am Crystal Woodward, Vice President of the ADA's Legal Advocacy Division, and have led the Safe at School initiative for almost 3 decades. In addition, I have been a T1D parent for the last 34 years, so I understand the challenges and stress in preparing to send your child with diabetes back to school. Today's webinar will give you information, guidance, and confidence as another school year gets underway. I want to let you know that we are recording this session, and a link to the webinar will be provided at a later date. Also, the information you receive today from the ADA does not constitute legal or medical advice. For legal advice or representation, contact and consult an independent attorney. And for healthcare consultation, consult with your professional healthcare provider. Today's session will provide an overview of Safe at School legal protections, the importance of written plans, and strategies for working with your child's school nurse to ensure a smooth transition back to the classroom. And also, we'll talk about free resources that we encourage you to read and share with your school nurse and administrators and teachers. At the end of this presentation, there will be time for questions and answers. As you're listening to our presentation, please be sure to type your questions in the chat box. We'll do our best to answer your questions throughout the webinar through the chat, and we'll also have time at the end of the presentation to answer questions. Today, I have the honor and pleasure of co-presenting with Kelly Busin, MSN, BSN, RN. Kelly has been a certified diabetes care and education specialist for 5 years, and she is passionate about enhancing diabetes care in the school setting. Kelly is an active member of the American Diabetes Association's Safe at School Working Group and the Maryland Diabetes in School Work Group. Thank you so much, Kelly, for presenting today. Now we'll get underway with today's back to school presentation. So at the American Diabetes Association, our mission is to cure diabetes and to prevent diabetes. The third part of our mission is to improve the lives of those impacted by diabetes, the patient with diabetes and their families. Today, our program is going to focus on advocacy, in particular, our Safe at School initiative, and helping to ensure that your child is safe at school while having access to all school-sponsored activities. Safe at School is founded on 3 principles. First, all school staff members need to have basic knowledge about diabetes and know who to contact in the event of a diabetes emergency. So these are staff members who see your child, interact with your child, have custodial responsibility for your child. They need to have some basic knowledge and need to know what low blood sugar looks like, and they need to know what to do in the event of low blood sugar. The school nurse is the primary provider of diabetes care to our children. The school nurse is also the coordinator of diabetes care. However, the reality is that not every school has a full-time school nurse. And even in those schools lucky enough to have a full-time school nurse, the school nurse cannot be in all places at all times. So for those reasons, ADA supports a model whereby teachers, coaches, and others are trained to provide diabetes care in accordance with your child's diabetes medical management plan, which we will talk about later, and or medical orders from your child's provider. And third, for students who are able to do so, they should be permitted to self-manage their diabetes anywhere, anytime in the school setting. And these principles are supported by all of these organizations. So what are the goals for safety and fairness for students with diabetes? Schools must provide a medically safe environment for students with diabetes. And part of what this means is that there should be trained personnel available at all times to provide diabetes care. Students with diabetes must have the same access to educational opportunities and school-related activities as their peers. So having diabetes should not preclude your child from participating in any school event. In order to participate in a school event, there should be a trained employee or school nurse available on site at all times to provide needed care for your child, especially in the recognition and prompt treatment of low blood sugar. And schools should work with the parent, guardian, and the student to support transition to independence, because we know that diabetes is a self-managed condition, and we want to work with the school to eventually make sure our kids are independent in their self-management. But we know that's a gradual process. And because kids spend so much time at school, that certainly it makes sense for the school to be involved to support that transition. Here's what we know. Diabetes care is 24/7. Our kids can't take a break from diabetes when we put them on the school bus in the morning. A smooth transition from home to school is essential. However, we know that the delivery of care may be different. I mean, we've got different environments, and we have, the parents providing care versus the school. So there are going to be differences in what kind of care is provided and in the timing. And that's something that you really need to talk with and work out with your child's school nurse. The student with diabetes must have access to their equipment, supplies, medication, snacks, and of course, access to trained personnel. Fluctuating out-of-range blood glucose levels may negatively impact learning and behavior. So we know when our kids' blood sugars are out of range, they're really low or really high, they're not feeling so great. So that's going to impact their academic ability and also their ability to participate in school-sponsored activities. And written plans are essential, and we'll talk a little bit about those: 504, IEP, DMMP, and emergency plans. So what are some key strategies for you as the parent? To engage with the school in the spirit of cooperation and partnership. Our kids are going to be in school for a long time, and we want to make sure we're all working together as a team for the best interest and safety of the child. Be realistic and reasonable. My mantra has always been, ask for the universe, but expect the world. Communication is so important. Clear communication. If you run into some concerns from your school or objections, be sure to understand the reasoning behind those objections and concerns, and try to work that out. Be sure that you're providing supply snacks and a quick acting form of glucose to your school on day one. That is the obligation of the parent, is to provide those things. Provide updated contact information. Make sure your cell phone and your email addresses are current on the paperwork. And work with your child's diabetes care team and the school to develop the right plan for your child, an individualized plan, and to prepare staff for success through training and support. I mean, training and education really are the key. So I'm going to soon talk about federal discrimination laws, and when your child does not have access to safe access to school or school-sponsored activities, that is called discrimination, and that is a violation of federal law and many state laws. So what form does discrimination take? How do you know if your child's needs aren't being met and if they're just being discriminated against? So what does discrimination look like? If a parent's required to come to school or child care to give their child insulin or provide other diabetes care. If your child is being refused enrollment by a child care provider or a private school, that may be discrimination. Schools or child care environments without a school nurse or trained non-clinical school staff members. Children being told they can't go on field trips or participate in school-sponsored activities unless a parent comes along. Student athletes not being able to safely participate in school sports or other school activities because the school fails to provide trained coaches or staff. Students who are denied smartphone access to manage their diabetes, this could constitute discrimination. And students who are denied the opportunity to take an exam at an alternate time if they are low or high. So there are both federal and state laws that provide legal protections to students with disabilities, and diabetes is a disability under these laws. So when you hear that word disability, just know that that is another tool in your toolbox to make sure your child is getting the care he or she needs at school. So there are three main federal laws: the Americans with Disabilities Act, Section 504 of the Rehabilitation Act of 1973, and the Individuals with Disabilities in Education Act. And there are also their state laws and regulations and guidelines, and each and every state has its own laws that are relative to the provision of diabetes care in the school setting. So you want to make sure that you know where to find these laws and know what these laws mean for your child. So with the Americans with Disabilities Act, which was actually amended in 2008 to include diabetes, because diabetes is a substantial limitation of the major life activity of endocrine function. And I know that's a mouthful, but that is what the amendment in 2008 provided. So there are various provisions under the Americans with Disabilities Act. Title II applies to schools and child care programs operated by a state or local government or conducted on public school grounds, such as after-school activities. Title III applies to places of public accommodation, and this is generally defined as businesses that are open to the public and fall into certain categories. And one of those categories is school, and another category is daycare. So if you're listening today and you have a child in daycare, you'll want to know that. And essentially all programs that are open to the public have legal obligations under the Americans with Disabilities Act. Religious schools are generally exempt from the Americans with Disabilities Act. However, religious entities receiving government funding do have legal obligations under Section 504. So what does the ADA require? It prohibits discrimination. It defines diabetes as a disability, which is a physical impairment that substantially limits a major life activity. And we've got some of these major life activities listed here. And it requires entities such as schools and daycares to make reasonable modifications in their practices to ensure that children and students have equal access to its programs and services. And the United States Department of Justice has enforced the ADA against several child care centers regarding children with diabetes. So we know that both the Department of Justice and the Department of Education have been instrumental in enforcing both Section 504 and the Americans with Disabilities Act. So Section 504 has the same standard as the Americans with Disabilities Act. It applies to public and private schools receiving federal funds, including the religious operated schools. And it also applies to childcare settings. When the childcare provider receives federal funding, as I said, the standard and rules similar to ADA. And under Section 504, for the children who qualify for services under this law, a Section 504 plan should be developed for these students. And then we have the Individuals with Disabilities Education Act, which is a special education law. And under IDEA, it must be demonstrated that the diabetes or another disability adversely impacts the ability to learn and to progress academically, unlike Section 504. Section 504, there are a variety of major life activities, including endocrine function, eating, walking, performing manual tasks, any of those functions that are seen as major life activities. Those kids are eligible for services under 504. And then if your child is diabetes is impacting learning, interfering with learning, or if your child has another disability that interferes with learning, he or she may qualify for services under IDEA. And rather than develop a Section 504 plan, you would develop what's called an individualized education program, or IEP, for your child. There are state laws and regulations. The ADA has some great information on our website. I have the link at the bottom, and I'll type it into the chat once I'm finished with my part of the presentation. But all states have different laws. In particular, Board of Nursing regulations and laws that dictate who can and who can't provide care at school. Often there's no statewide policy, rather policies determined district to district. So you may have different school districts with different policies. Some states have developed school diabetes care management guidelines. Some states have passed school diabetes care legislation, related laws or regulations. Just know that regardless of state laws, the requirements of federal laws must be met. So if your state prohibits anyone but a school nurse from giving providing care to your child, then it is the responsibility of that state, of your responsibility of your school to still make sure that your child has needed care, which probably means there needs to be a school nurse there at all times. So you just want to check and be familiar with your state laws. I also wanted to mention with the state laws, some recent developments. There are now 40 states with cell phone restriction statutes. So you'll want to know if your state has a cell phone restriction law. These laws take different forms. Most, if not all, of these laws contain an exception for students who need to access their smart devices for managing a medical condition. If your state law does have this exception, the association recommends that you still write that provision into your child's 504 IEP to make sure your child does indeed have access to their smart device to manage their diabetes. The second state law we are seeing are the undesignated glucagon laws that allow your child's school to obtain a prescription for stock glucagon so that there's glucagon on hand at all times. In the event your child's glucagon has expired or you forget to bring it in, that there's a little bit of a safety net there. So you'll want to go on ADA about what your state laws say. Just a quick case study. Jeffrey is a high school freshman who is newly diagnosed with type 1 diabetes. Jeffrey is an honor student and has no other chronic illnesses or disabilities. Is Jeffrey eligible for a 504 plan? The answer to that is yes, Jeffrey is eligible because learning need not be adversely impacted in order for a student to qualify for services under 504. And Jeffrey has diabetes, which substantially limits endocrine function, plus a number of the other major life activities. So even though learning isn't impacted, this child should still have a 504 plan. So written plans, these are the major plans, the diabetes medical management plan, or doctors or providers' orders that your child's provider will complete and work with you to complete and sign and transmit the plan or medical orders to your child's school nurse. And then there's the 504 plan or IEP that is developed by the 504 and or IEP teams, which includes the parent, the 504 coordinator for the district, school administrators, school teachers. So ADA does recommend that every student with diabetes have a 504 plan or an IEP or other written accommodations plan, which describes the accommodations that the school is to provide to your child so that your child can safely access the school environment. And then there are IHPs and IAPs. Those are more or less like the school nurse's internal roadmap for providing diabetes care to your child. And then the association has a couple of quick reference tools in our school guide on how to recognize and treat hypoglycemia. We have a new template, 504 plan, that we made available on our website maybe about 2 months ago. So the 504 plan is the written document where the families and the school agree upon the services, modifications, and accommodations that will be provided to the student. It is individualized, and it should be based upon the student's individualized diabetes medical management plan. A DMMP or medical orders are not a substitute for this plan. And also I get the question many times, does my child need a 504 or IEP if he or she has a DMMP? And the answer to that is unequivocally yes, absolutely. Your child still needs the written accommodations plan so that everyone knows their roles and their responsibilities and what their role is in meeting the needs is laid out by the DMMP. And also the written accommodation plan is really a team effort where the 504 IEP team come together to develop, and there is legal recourse for a school's failure to provide accommodations. So there's a legal remedy involved with the development and putting in place of a 504 or IEP. So again, the benefits, helping to clarify the roles and responsibilities of all the stakeholders. It validates the health condition for the students. It employs a formal legal process, and it gives the student and parents the comfort in knowing the student will be safe and treated fairly. So absolutely essential that the parents work with the school to develop an individualized plan. It's not a one-size-fits-all. Not, every child with diabetes is different and has different needs. So you'll want to individually develop that plan. So some of the examples of accommodations that might be provided in the plan, I'd say first and foremost, and it is the responsibility of the school, and I would document this in your child's 504 plan, that it provide a school nurse, and if the school nurse is not available, there should be trained non-clinical school staff who are ready, willing, and able and on-site to provide that care to your child, whether it's during the school day, during field trips, or at other school-sponsored events. Provide Wi-Fi and smartphone access, permit and support the student's transition to self-management diabetes, allow time to make up tests and assignments, full access to the restroom and water, full participation in all school-sponsored opportunities, and where needed, provide CGM remote monitoring access to your child. Navigating the 504 process, how do you get started? The parent should contact, first of all, identify the school's 504 coordinator and reach out to the 504 coordinator to initiate the process and to schedule a meeting. Schools can also initiate the 504 process, but most of the time it is the parent who initiates the 504 process. And you want to do that upon diagnosis, or hopefully if you haven't done that already, after watching this webinar, it's something that you will go back and do and reach out to your school's 504 coordinator. There is an evaluation for eligibility under Section 504, as the 504 regulations do require individual assessment. Once that determination has been made, the 504 IEP team will then get back together with you, the parent, to develop a plan. And the 504 plan and IEP are critically important pieces of the diabetes toolbox for all students with diabetes. And don't wait until there's a problem. Get to put a 504 plan or IEP in place while everything is going well at school. You don't know if the players are going to change tomorrow. Maybe that principal who gets it is transferred to another school, or your child's teacher who also has a child with diabetes, maybe she decides to teach a different class or is moved to another class. So put things in place, put those written plans in place while things are going well. Don't wait for a problem to arise. Be proactive, not reactive. So study number 2, Lillian is a high school senior and was diagnosed with diabetes at the age of 5. So she's had diabetes for a while. And she's probably independent, right? And she's going on an overnight senior class trip in the fall. So what kinds of accommodations would be appropriate to put in Lillian's 504 plan? Certainly having available trained school staff on this class trip. It may or may not be a school nurse. It may be a trained teacher to help recognize when Lillian is low and maybe can help to get her a juice box or some glucose tabs. I think that is the most critical provision you can put in your child's 504 plan, no matter their age, that there be a school nurse or trained non-clinical school staff always available, and certainly holds true for a field trip, whether your child is independent or whether your child is newly diagnosed and young, and depends on the school nurse or school personnel to help with their diabetes care. So now I'm going to turn the program over to Kelly, and please don't forget to type your questions into the chat. Kelly?
Thank you, Crystal. I'm excited to be here with you all today, and I'd like to continue the conversation of how to start your child's school year off right, which really does require some proactive planning and collaboration between families, school staff, and your diabetes care providers. This planning revolves around 4 components that I believe are the most important foundational blocks of creating a safe school environment. The first one is a detailed diabetes medical management plan, or DMMP, which guides daily care for your child. The second component would be setting up a school nurse meeting to review your child's needs, as well as the responsibilities of the school nurse, the caregiver, as well as even the student. You also want to make sure that you have preparations for emergencies and lockdowns, as well as special events, to make sure that there's no gaps in diabetes care. And then the last pillar is training for school staff so that we can ensure that your child can be responded to confidently and effectively in any diabetes situation during the school day. So to start, let's begin with the DMMP. Earlier this year, the American Diabetes Association Safe at School Working Group worked diligently to take feedback from families, school nurses, and diabetes providers to improve the DMMP with the goal of simplifying and improving school diabetes care. It now features a provider-completed diabetes care task management section and enhanced, clearer instructions for managing both high and low blood sugars, amongst others. Overall, the plan is shorter in length. It does require more input from the provider, and the updated DMMP can be scanned using the QR code on the slide or at the website provided on the slide. So the first change that we should talk about is Section 1. If you're familiar with the previous version of the DMMP, you can see that Section 1 of the new DMMP is parent completed, and it's a whole lot shorter. It focuses on essential information that the school nurse needs to plan your child's daily diabetes care and interventions. And really, this section is an excellent opportunity for families to emphasize your child's specific and individualized needs that must be addressed throughout the school day. Section 2 of the DMMP, also completed by the family, lists the essential supplies that must be provided to the school nurse at the start of the school year. This section is really important, even if your child uses advanced diabetes technology, because it lists all of the needed backup items for diabetes care to persist throughout the school day so that your child can still receive the same level of care at school and prevent unnecessary learning disruptions or even an early dismissal. Um, it is also important to know that if insurance coverage for extra supplies is a challenge for you or your family, it would be important to reach out to your diabetes provider so that they can give you support in getting enough supplies to be able to have at home and also in the school building. Shifting gears, Section 3 and beyond will now be completed by your child's diabetes provider, which is a little bit different than the previous DMMP. Section 3 outlines your child's ability to perform specific diabetes care tasks. If your child is marked as supervision or self-care by your diabetes provider, the school nurse will need to verify that your child can complete these skills appropriately before allowing them to complete them on their own during the school day. But it is important to know that if your child is marked as self-care, the nurse still continues to support them in the background and remains a backup if anything was needed by your child throughout the day. Because providers don't really see how your child is interacting with their diabetes on a daily basis, it would be important at your diabetes appointment prior to the start of the school year to really let your provider know how your child interacts with these specific diabetes care tasks, meaning whether they need full help, maybe some occasional reminders, or they really are fully independent so that the provider can accurately fill out this section for the start of the school year. The remaining sections of the DMMP outline both standard and personalized care. It covers when and how to check blood sugars, insulin delivery methods, whether your child's using a pump or injections, dose timing, management of highs and lows, and ketones. For pump users, it's important that the DMMP matches the pump's program settings to ensure safety and consistency with insulin dosing during the school day if your child had to receive an insulin injection by the school nurse for any reason. And as Crystal mentioned before, it's important to know that while the DMMP may differ slightly from how you manage your child's diabetes at home, the goal of the diabetes management during the school day and ultimately the DMMP is really to ensure that your child receives safe, effective care that follows current clinical guidelines and recommendations from your diabetes provider. And the big takeaway with this is that it should be a collaboration and a conversation between you and your diabetes care provider to make sure that you feel confident that your child is receiving care that is safe and how you would prefer in some situations it to look during the school day. All right, so now that the DMMP is complete, the next step is setting up the school nurse meeting. Ideally, this meeting should be held before the start of the school year to ensure that the school nurse is prepared and has all necessary supplies to begin caring for your child on the first day of school. As you're setting up the meeting, you'll want to consider who should be part of this meeting. Ideally, it would be important to invite key staff members. Obviously, the school nurse should be there, but if you have a health assistant in your school building, it would be important for that person to attend, as well as any pre-established backup personnel or school staff, like teachers, coaches, the principal, whomever has been determined to be a trained diabetes care provider. And then finally, you'll want to think ahead about what you would like to discuss. I personally feel that the DMMP is a great outline to follow throughout the school nurse meeting. And you can go section by section because it allows families the ability to share details about your child in very specific ways as it pertains to each section. But it also gives the school nurse opportunities to ask pertinent questions about your child and even share some student management guidelines or what they typically do during the school day in certain situations. This meeting is also an opportunity to discuss food and diabetes supply access and how you should plan to communicate with the school throughout the school year, as well as what you would like to be notified about during the school day. And then, as Crystal mentioned before, make sure there's a plan to train additional staff for times when the nurse may not be available. And this would really pertain, especially if your child takes part in extracurricular activities or after-school programs and even field trips. So let's do a case study to walk through a school nurse meeting for 9-year-old Maya. Maya has type 1 diabetes and is managed by a hybrid closed loop system, insulin pump, and a continuous glucose monitor. She's starting 4th grade at a new school with a full-time nurse who mom was told is unfamiliar with advanced diabetes technology, but she is familiar with basic daily diabetes management. So 1 week before school starts, her mom asked to meet with the school nurse to review Maya's DMMP and discuss important aspects of Maya's daily diabetes management tasks. So what are some really important topics that Maya's mom should discuss with the school nurse at this meeting? Really, the group should go through the DMMP section by section, starting with Maya's daily schedule if possible, and include her mode of transportation, like if she is a walker or a bus rider or a car rider, and Maya's specific target glucose levels before dismissal, which may be very dependent on how long her commute is and whether or not Maya may have a trained adult at home to help her when she gets back to the house. As I mentioned before, you should also go over meal and snack plans, ensuring that Maya has easy access to carbohydrates when needed. And it would be important to ask if it's possible to have classroom toolkits that contain water, snacks, and low treatments in all of Maya's classroom settings so that if she needed a quick intervention for a low blood sugar, it would be quickly available. Of note, if you do choose to request a classroom toolkit and it's easily agreed upon, it is the parents or the caregiver's responsibility to create and upkeep the supplies throughout, but the school nurse should know where they are kept and she should be, or they should be able to communicate when supplies are running low so that they can be restocked. Another helpful tool that Maya's mom can create and give to the school nurse for the meeting is a 1-pager sheet that has a color picture of Maya with pictures of the low treatments that Maya uses in her classroom toolkit, like the juice boxes and specific candies that she uses, as well as her symptoms of low or high blood sugars and any other important information about Maya, like if she's using a CGM or an insulin pump. The nurse can plan to include this paper with Maya's emergency action plan in every classroom setting, which would be really helpful in the event that Maya has a substitute teacher or is emergently being cared for by someone who's not as familiar with Maya on a regular basis, or maybe they had training, but it was a few months ago and they don't remember everything. So this is a quick guide for them to Maya's diabetes care. And it's very specific to her. So I really like this idea. I think that it would be great, especially, like I said, for a substitute teacher, someone who's just meeting Maya. The group will also want to review the plan for technology failure, like does mom want Maya to resume injections or finger sticks for the rest of the school day until she can get home and then those devices can be replaced? Or can Maya do this independently during the school day? So talk those things through so that everyone's on the same page. And then it won't be so jarring if it does happen during the school year. As you're discussing, backup plans, it's important and it's a great opportunity for Maya's mom to be able to provide all of those necessary backup supplies that we talked about and that are listed in section 2 of the DMMP. And then finally, it's important that the nurse understands how to respond to CGM alarms, when to check a finger stick, And then it would be really helpful if Maya's school time CGM alarms match the actionable alarms on her DMMP so that Maya doesn't have alarm fatigue and she really can be part of an inclusive learning environment. Of note, some CGMs do have multiple alert profile capabilities. So if you do have a CGM that allows you to program different profiles, it might be helpful to program a school day profile. And finally, the school nurse should discuss key elements of the emergency action plan so that Maya's mom is familiar and comfortable with how these situations would be managed during the school day. And then once the nurse has all of this information, their job is to then further develop the IHP and the EAP that Crystal discussed earlier, using individualized templates that may be state specific or school district specific, as incorporating the input from Maya's mom. All right, so moving on to our next pillar. Once the school nurse is prepared after the school nurse meeting, the next step is training other staff. Caregivers and school nurses should work together to identify which school staff should receive training and what level of training and support they should actually receive. At minimum, trained staff should understand basic diabetes care, as well as recommended target glucose levels. And their training should really match their school role. So for example, a gym teacher and an after school care staff members should know how to treat low blood sugars and use glucagon in emergencies at minimum. All staff involved in your child's learning should also review your child's emergency action plans, especially as it pertains to high and low management. And it's important that when you're training these school staff and you're supporting the school nurse who should also be training these school staff, that trusted resources are being used. And that may require you collaborating with your child's diabetes care provider so that they can make sure that the plan fits your child's needs, but also provides support if needed. So let's go a little deeper into school staff training because it's really a very important factor in keeping your child safe when they're at school. There are 3 levels. Level 1 is basic training for all staff. And this covers what diabetes is, signs of high and low blood sugars, and who to contact in an emergency. Level 2 would be more geared towards teachers and staff who regularly interact with your child. This would include how to treat lows, target glucose ranges, and managing activity-related changes and challenges. And then level 3 is really an in-depth training for select staff who will be trained specifically by the school nurse or by your diabetes care provider. And it covers daily and emergency care like giving insulin and checking blood sugars, which would be really important, especially for students who require full support. And really, this layered approach ensures that someone is always ready to help your child during the school day, no matter what the situation is. I personally feel that the American Diabetes Association's Helping the Student with Diabetes Succeed guide is an amazing resource for school staff training. It's broken into 6 main sections that cover everything from the basics of diabetes and age-appropriate care to the roles of school nurses, school staff, families, and the students. And it includes helpful management tools like sample care plans and emergency protocols. It explains legal protections again if you need a refresher. And it even offers a glossary of terms if you hear something that you're unfamiliar with. Another great resource is the ADA Safe at School training modules. The website is listed on the slide. And these easy to follow and short PowerPoint slides include videos and quizzes that cover everything from diabetes basic care, which would be level 1, all the way up to advanced topics like CGMs, insulin delivery, glucagon use, ketone management, things that are more on a level 3. One standout feature of this resource is the real-life case studies that help nurses, staff, and families plan for scenarios like student self-management, remote monitoring, And there's a ton of other resources in there for that. All right, so now that we've covered key training tools, let's take a look at a real life example to show how training can be tailored to a student's needs. Leah is a 15-year-old high school sophomore with type 1 diabetes. She uses a CGM. She takes multiple daily injections and she plays varsity soccer with 2-hour practices after school. She's mostly independent in her diabetes care, but she has had some lows both during and after activities. So which staff should be trained and what specific topics should be covered? So when it comes to training for sports and after school activities, it's important that the coach, the assistant coach, and the athletic trainer, if there is one, really know what their role is in supporting Leah's diabetes care. They should understand how exercise impacts Leah's blood sugars, what Leah's target glucose ranges are, both before, during, and after exercise, and Leah's specific signs of low and high blood sugars. They also need to know when to have Leah pause activity for treatment, as well as how to use glucagon in an emergency, and where they would find the emergency action plan, whether it's posted in the gym, the coach's office, or the team travel folder, which, preferably it would be all three. If the school nurse is unsure of how to appropriately manage Leah's diabetes after school and what the coaches should be trained on, it may be important to consider some collaboration with Leah's diabetes care provider for some more specific input to ensure that Leah remains safe in this extracurricular activity. So I've mentioned the emergency action plan a few times now, so let's talk more about that as our next key component in keeping your child safe at school. So just as background, an emergency action plan for diabetes covers all the steps that staff would need to know in helping your child in an acute event. And this would include what to do for low blood sugar, severe lows that might need glucagon, how to handle a high blood sugar, when to call 911, and how to communicate quietly in the event of a lockdown requiring silence. Because the focus of this document and plan is to ensure acute safety, meaning in the next 30 to 60 minutes, potentially a little longer, hopefully not too much, insulin administration and acute ketone management is not specifically addressed in all of the emergency action plans. So you would need to talk to your school nurse specifically about the emergency action plan that your school uses. But overall, this document serves as a quick guide to keeping your students safe and giving school staff some guidance on exactly what to do in any diabetes-related situation. So let's take a look at Spencer, who's a young student with type 1 diabetes, to see how lockdown and emergency preparedness planning can be tailored to meet his specific needs. Spencer's 6, he's in kindergarten, he has type 1, uses a CGM and a hybrid closed loop insulin pump. And he can sometimes tell when his blood sugar is low, but he still needs adults to manage all of his diabetes care. So at his back to school meeting, his family plans to talk with the school nurse about emergency lockdown plans and preparedness. So what specific topics should his family plan to discuss? So for lockdown situations, it would be important for Spencer's family to ensure that he always has quick access to his low supplies, like that classroom toolkit that I'm a big fan of and I've mentioned a few times now. And this will allow any staff member who may be present with Spencer during a lockdown or emergency to appropriately treat any low blood sugars in a safe and timely manner. In regards to low blood sugars, the emergency action plan should also detail treating the lows right away, including when and how to give glucagon and when to call 911 if Spencer were to become unresponsive. However, during a lockdown, since insulin administration and ketone monitoring is not typically addressed, Spencer's plan may suggest that staff members encourage drinking water, knowing how to silence device alarms if that's needed, and quietly communicating with the school nurse or other members of the medical team. And then additionally, any specific things that Spencer might need to keep him safe during an acute situation. The emergency care or action plan should be available in the appropriate classroom settings so that any staff member who comes in contact with Spencer in a classroom setting has appropriate information to ensure that he stays safe. The next thing we should talk about are special considerations for field trips and extracurricular activities, and it kind of pulls on everything we've already talked about at this point. When planning for after-school activities and field trips, you always want to consider who's running the program, meaning is it school-sponsored or an outside group? The timing, is it 1 hour, 2 hours? Whether the health room staff will be available. And then if the health room staff is not available, then you need to determine what other school staff will be trained on diabetes management, as well as what level of training they should receive. Ideally, this would be level 3. So that they can do daily diabetes management tasks. And then you'd also want to make sure you think about and collaborate with the school nurse about how and where their diabetes supplies will be stored, low treatment access, snacks, and making sure they're all accessible at all times. As a side note, Crystal did mention earlier that families, it's a discrimination for children to be told that they cannot go on a school field trip. And so I want to make sure that I let you know that when you're organizing field trips or after school programs, there is something called the first right of refusal policy. And this allows a trained family member or designated adult to accompany a student with diabetes on a field trip. However, if they choose not to, the school is still responsible for ensuring that trained staff are available to support the student during the field trip, and they are still permitted to go on the field trip. It's also important to consider when you're thinking about all of this, the nature of the activity for the after school program or field trip. Like, will it involve high physical exertion, which would increase the risk of a low blood sugar, or will it be more stationary, like arts and crafts? And so that's not something you need to worry about as much. And this is helpful because it helps the parents, the caregiver, and the school nurse prepare appropriately with the right supplies and staff training so that your child stays safe during this time. Overall, the school nurse in this process serves as a consultant and ensures safe diabetes care by training the appropriate staff that's been designated, making sure that that staff and your student have access to the supplies needed to manage diabetes, and making sure there's always clear communication. I also want to talk briefly about bus safety for kids with diabetes, which is another important consideration. For both the school nurse and the parents, if your child is a bus rider, it's important to ensure that your child has an appropriate glucose level before boarding the bus, which really is meant to reduce any low or high blood sugar emergencies. It may also be reasonable for families to work with the school nurse and possibly the 504 team to make sure their child can sit where their driver can see them, especially for younger kids, and that they're always allowed to eat, drink, check their sugar, and use any diabetes device, including cell phones, on the bus. Families can also ask for 504 accommodations, like being your child being picked up last on the way to school, dropped off first on the way home from school, and possibly having a bus aide to make sure that your child stays safe. The school nurse should also ensure that bus staff get basic diabetes and emergency training, including when to call 911, if a child is seizing or unconscious, how to give glucagon if it's available and the bus driver's been trained. And then they should reinforce that high blood sugars alone are not necessarily a medical emergency on short rides. So the last consideration I want to talk about is remote CGM monitoring. So when it comes to CGM remote monitoring, families and school nurses should work together to create a clear plan. For families, you'd want to meet with the nurse and the 504 IEP team to include CGM use and remote monitoring in the plan if possible. You'd want to ensure that your student has access to their device at all times, even during exams. So again, that would be a 504 accommodation. And then provide backup meter supplies and clarify who responds to alarms in the event of, testing or just during the school day. For school nurses, if the school doesn't have a dedicated device, families may provide one because staff cannot use their personal phones. It is important to know that one device can monitor multiple students. And so the nurse may want to consider a shared setup if possible. And school nurses will also want to ensure that devices are connected to school Wi-Fi. So your child's device should be connected to the school Wi-Fi. And if the signal is weak, they may want to consider discussing with administrators the installation of extenders or whatever needs to happen so that there's no gaps in glucose data. And then it's important to remember that remote monitoring adds support but doesn't replace hypoglycemia protocols. Roles, alarm responses, and procedures should be clearly defined in the 504 plan or IEP if that has been added. So let's review the steps for preparing your child to go back to school for a safe and successful school year. First, you want to ensure that your DMP is current and includes specific insulin schedules and dosages. Schedule a school nurse meeting before the school year starts. Know which staff are trained to provide diabetes care for your child. Um, of note, state laws, check your state laws, but there are some that allow teachers and staff to be trained in insulin and glucagon use. And then support your school by sharing training resources like the ADA's modules, provide up-to-date emergency contact information, send plenty of supplies and snacks, which may be stored in accessible locations for staff and your child, and then create your classroom kit with a photo of your child, and list symptoms of high and low blood sugars, treatment instructions, and information to your child. All right, Crystal, back to you.
Thanks, Kelly. That was wonderful. And I'm sure it was very helpful to all the folks tuning in today. Just a reminder that the American Diabetes Association Safe at School Initiative has a multitude of comprehensive free resources on our website. You can access all of those by going to diabetes.org/safe at school. Some of these resources include template 504 plans, DMNPs, our school guides, CGM guidance, fact sheets about field trips, lockdown, standardized testing, and then there's information on federal and state legal protections that I recommend everyone take a look at. Also, if you are having an issue, if your child's facing a diabetes care issue at school, please give us a call, send us an email, and we have information to help and guide you through the resolution process. Or if you just want some general information about how do I develop a 504 plan, what's the process, reach out to us, and our legal advocate will respond to you very quickly with the needed information. And then with that, just a few questions. Kelly, uh, what do school nurses want parents to know? What are some of the key things that school nurses would like for parents to know?
I would say that the most important thing is that they are working to make sure that your child is cared for in the safest way possible. And that the goal is always to follow the DMMP to make sure that they are aligning with updated standards of care and current practice recommendations, which come from your providers. But really that it is a collaboration between the parents and the caregivers and the school nurse, because that is what creates the best working relationship to make sure that your child has a great learning environment throughout the whole entire school year.
Great, thanks. There's a question about if there's an updated Safe at School document for the 25-26 school year. I'm not exactly sure which document that refers to. There is an updated diabetes medical management plan that we spoke about today that's available from our website. A shortcut to that would be diabetes.org/DMMP. The association recently updated its school position statement to address new technology and other current issues. So you can also access the school position statement. We do have our Safe at School guide that you could use to help to educate. So take a look at all those resources. We have a lot of great resources online, and they're all free for you. And I recommend that you share them with your school nurse, school administrators, and other school personnel. Let's see. Kelly, what should be the backup plan if my child's pump fails?
I think this is really independent and individualized. I work with a lot of children who the preference is I don't want to get injections. I want my pump replaced as soon as possible. And so for them, the backup plan will likely be or may, be that the nurse contacts the family, and either the family comes, if they're capable of doing this, coming to the school and changing it, or teaching the child themselves how to do it so that they can and have the supplies at the school so that they can do it. But ideally, whatever the plan is, it should minimize, like I said, early dismissals so that, children really have the best learning experience because that's the goal of all this, right? We want them to be just like every other student and have every learning opportunity that they have as well because there's no reason that they can't. Um, I think if the student is willing to go to injections for their lunchtime dose, if there was a technology failure earlier in the morning, then it would be really appropriate to notify the parent or the caregiver and resume and have one injection for lunchtime and then replace the devices when you get home, so that they don't have to miss class or miss school.
Thanks, Kelly. So we are out of time. Um, Thank you so much for attending ADA's Back to School webinar. We hope this information and guidance has been helpful to you. Please know the American Diabetes is here for you. A link to this session will soon be available. You can also obtain more information and guidance by calling 1-800-DIABETES or emailing askada@diabetes.org. Again, thank you for attending and wishing you and your child a safe and successful school year. Thanks.